I'm going to now demonstrate for you my typical shoulder examination. Now let's assume for the purpose of this video that an extensive subjective history has already been taken, and if necessary, a full upper quarter screen has been performed to completely rule out the cervical spine. So now that the C-spine's ruled out, let's start to check out shoulder. So let's have your patient stand up. Good, we want to start with active range of motion. So I'm going to come over here. Now for the purpose of this examination, we're just going to focus on one shoulder, but in the clinic you're going to always want to evaluate both sides to compare. So let's start with flexion. So with the thumb up, I'm going to ask my patient to come straight over their head. Is any pain present with that? Nope. If there's no pain, we want to do an overpressure, just like that. We'll then do abduction, coming out to the side and all the way up. No pain, we want to perform an overpressure. Good. We then want our patient to put both hands behind their heads, interlocking their fingers, and stabilizing the scapula. We can provide an overpressure. Good, so we're getting external rotation and abduction in this position. We then want our patient to place one hand behind their back, just like that. Good, this is internal rotation and extension. We can provide some more extension by pulling back on the elbow, or more internal rotation by pulling back on the wrist. Any pain with that? No. Okay, good. So that's active range of motion. We then want to begin passive range of motion. So have your patient lay down on the plinth, just like that. Try not to get in your way here. First thing we want to do is, again, flexion. Okay, so take your patient all the way back into flexion. Coming just like that. Giving some pressure there. Checking out the range, coming into abduction. Here we go. All the way up. Good. We then want to check internal and external rotation. Try to stand over here so you guys can see. Start with external rotation at about 20 degrees. Blocking the glenohumeral joint. Coming into external here. Check external at 90. And external at about 120 as well. Okay? We then want to check internal rotation. So again, we want to check all ranges of glenohumeral abduction. There we go. Good. And that's internal rotation. Ooh. He's very limited in internal rotation, as you can see. A little bit uncomfortable as well. We then want to go ahead and check extension as well. So come back and check the patient's extension. Okay. In this position as well, we want to assess the capsule. So these are your accessory motions. So stand over here so you guys can see as well. First we'll check an inferior glide. Just relax at the elbow. Okay. We'll check an inferior glide, assessing the inferior capsule. We can also do an anterior glide. Okay, we can stabilize a bit better here. Good. And a posterior glide. Relax, bend here. And assess the posterior capsule. We can also assess the posterior capsule another way, just like we mobilize it. Adducting, internally rotating to wind up the capsule. We want to block the scapula. This is tough to see here. And just performing a force here toward the plinth. That's posterior capsule assessment. Good, so then we want our patient to sit up again. Now that our accessory exam is done, we want to go ahead and palpate as well as manual muscle test. So I'm going to come just behind here. So by this time we already should have a general idea of maybe what's going on with the patient. So we want to target our palpation exam specific to that region. So we can assess the rotator cuffs here. Just like that. We can perform a little rent test. Good, just like that. Can feel the biceps tendon or anything else you're looking for. For the purpose of this exam, we'll just kind of leave it at that for now. We then want a manual muscle test. So for the purpose of this exam again, I'm going to come behind my patient. Have him bring his arms to his sides just like that. We'll test internal and external rotation. So first, I'm going to have him push out on my hands. Good. And now push in. Good. For flexion, have the hands straight out in front, just like that. Good. And resist. Good. And abduction. Set to the side. And resist. Good. Now that we've done our manual muscle test, we can also test our scapular stabilizers. If there's any winging of the scapula, we're definitely going to want to assess this. So have your patient in prone. Get rid of that. Excuse me. So to assess the inferior trap, what I want to do is my patient to bring their hand out just like that with the thumb up in the air. I'm going to come up here so I'm not blocking the video. and resist. Here you can palpate the lower trap. I then want my patient to come up just to about here with the thumb down and resist. Good. And this is assessing rhomboids. I then want the thumb up and resist. Good. And now I'm assessing mid-trap. All right. My patient can now sit up and relax. And now that we've done a thorough muscular assessment, we want to now confirm our examination results with special tests. So refer to the special tests here and perform any specific special tests to rule in a condition. And that's our shoulder examination.